Welcome everyone. We are in the core meeting session 1, U21 Health Sciences Group Annual Meeting 2021. This year, we are really glad that we as Tecnológico de Monterrey are hosting this event. Good morning, good evening, good afternoon, wherever you are. Today, we are starting with the core session 1 with Dr. Guillermo Torre, but first I would like you to put the program that we are having for this session. First, we are having the plenary, Prevention, Wellbeing and Longevity Before and After COVID-19 for 20 minutes. Then the panel, Healthcare Challenges for Prevention, Wellbeing and Longevity for 40 minutes. And we are glad to have here also Dr. Guillermo Torre, Patrick Fell for the University of College Dublin, Jorge Brown from Pontificia Universidad Católica del Chile, and myself from Tecnológico de Monterrey as a moderator. After that, we are going to split in breakout rooms to have some questions and answers directly with panelists. Well, I would like to introduce Dr. Guillermo Torre. He is Rector of TecSalud and Vice President of Research at Tecnológico de Monterrey. He is one of the founders of the Transplant Laboratory at Houston Methodist Hospital and was a board member of the Becky Heart Center run by Houston Methodist Hospital and the University of St. Thomas. He holds a degree in surgery and medicine from Tecnológico de Monterrey with a specialty in internal medicine and a subspecialty in interventional cardiology, heart failure and transplantation from Baylor College of Medicine, and a doctorate in immunology from the University of Chicago. It's an honor for me to welcome you, Dr. Guillermo Torre. The auditorium is for you. Thank you for being here today.
Gracias, Silvia. Thank you, and good morning, everyone, and good afternoon. I am going to try to share my presentation, so if you give me a moment. Here we go. Very good. So the task that I was given this morning, it's a great opportunity for me to present to you what we've done to outline our strategy at Tecnológico de Monterrey and TecSalud. And I'm going to take a couple of moments to first describe to you the transformation that Tecnológico de Monterrey has lived over the past few years, and then bring you a couple of ideas to put on the table and discuss about the importance of the future of healthcare for Mexico, how this may impact Latin America, and really, as I presented in the video, the opportunity that we have at universities to be a transforming force for the country. And as you all probably know, Tecnológico de Monterrey has had a medical school for many years. Today, we're probably celebrating 40 plus years of the creation of the medical school, but a medical school has also evolved over the last 10, 15 years. We really now are a healthcare system, and as Jorge, my colleague, always makes me express, we're really an academic healthcare system. And what it means really to us is that we not only have the opportunity to teach medical students, but we have an academic healthcare center that provides leadership in medicine in our community. And through the pandemic, an important role in the nation policies in healthcare. And with that, we've evolved also to provide opportunity for training for many residents across northern Mexico. And with that, we train people that come from all over the country. So I highlight the fact that the school not only has a teaching opportunity for undergraduate students, but we also are creating an environment where physicians are trained, and this provides us the great landscape to not only care for people, educate undergraduate, to educate those that are going to be providing care in the future, but also to have a very important role in public policy. And I leave you with that idea here as an introduction, because I think that what we're going to try to do in our new vision of healthcare is to also not only have that formative role, but also have a big impact in public policies in the country. And I think that is what I believe it's an important role in our mission towards the future. And so with that concept, let me have you observe to this slide that has the intention to understand what are the major health problems of society today. And I say today, and for most of all that are represented here in this meeting today, we live in countries that are completely living in a pandemic of cardiovascular disease. Look at the causes of death globally. This is not only in Mexico or in North America or Europe. This is the global causes of death, according to the WHO. So ischemic heart disease, stroke, chronic lung disease, respiratory infections, a few neonatal conditions, again, lung problems, dementia and Alzheimer's, diarrhea as communicable diseases, but diabetes and kidney. So if you look at 7 out of those 10, you can probably see that there is a common denominator. And the common denominator is that perhaps all of those are related to habits, and it is the root cause of most of these conditions have to do with nutrition, have to do with behavior. If we alleviate the problem of obesity and poor nutrition, plus change habits, if we cut smoking and we have better nutrition, better nutritional health, we probably can eliminate in a significant way ischemic disease, stroke, degenerative diseases of the brain, like dementia and Alzheimer's, diabetes mellitus. I mean, the great proportion of diabetes is not the genetic cause, it's not the viral-induced destruction of the pancreas or the immune-related condition, but it's really obesity that leading to insulin resistance. So I say to you, if you look at that table on the left, you see that with better nutrition and better habits, avoiding smoking, walking a little bit, maintaining a regular weight, you probably have the most significant impact in the major causes of global death. So now let's look at what happened during COVID. And this just picked out of the British Medical Journal. Look at the proportion of the comorbidities that lead to increased death with COVID. And it is exactly the same. You have cardiovascular disease, diabetes, chronic pulmonary disease, all of which are self-inflicted injury. Not all of it, but allow me, for the purpose of this conversation, to say that a big proportion of the conditions that lead to are self-inflicted. Poor diet, lack of exercise, little mobility, insulin resistance, smoking, and those, the common denominator, metabolic disease, obesity, all of which link to increased risk of hypertension, diabetes, as a catalyst to vascular disease that is the common root cause for ischemia, for the stroke, for diabetes. And the reality of it is that the same causes that lead to the global, the most common causes of mortality also become relevant as the major causes of comorbidity. So this highlights the importance of a strategy that addresses the root cause of the most common causes of death, the most common causes of comorbidity during COVID. And it really brings you to the question is, how do I address these problems? Well, those cannot be addressed by just performing angioplasties, coronary bypass surgery, removing a clot from the brain, or more complex medicines to treat diabetes. You know, we have an armamentarium for diabetes today that probably represents 7 new medicines that are expensive, that are costly, when perhaps the only thing that you can do is to teach people how to eat better. So when we put this into question, you say, well, how is it that healthcare needs to be transformed? So let me take a moment and with these two ideas, the causes of death worldwide the comorbidities that lead to high mortality in COVID, what is it what's happened? How did this combination of humanity that has poor health and the pandemic has created a catastrophic condition? So let me take you for a moment with this concept in mind, what's happened to Mexico? Why is it that the pandemic has now forced us to understand how we can improve health? So Mexico understood that there is a common risk factor, and the common risk factor is the state of poor health. And poor health essentially can be summarized as poor nutrition, poor habits with smoking, and lack of mobility. So, and this resulted in a catastrophic condition in Mexico. Mexico today has had at least 270,000 deaths due to COVID. And I said at least because since the strategy for Mexico from the beginning was to do very little testing, what used to be reported in media and worldwide as the number of cases, which are around 3 million, it's a gross underestimation of the number of individuals that have been affected by COVID. And that translates to a number of cases that died that are not properly diagnosed. It is not a strategy of hiding the causes of death. I truly believe that the Mexican government is not trying to hide it. But the fact that we have little testing, the fact that we have a hospital system that is overwhelmed and many people cannot come into the hospital for care has led into an interesting phenomenon where Mexico may be among the countries where the excess mortality that occurred in 2020 to 21 is of dramatic proportions. So that if you look at the expected mortality in 2020-21 compared to what's happened the prior years, we would have estimated that we had anywhere between 850,000 deaths in that time period. But the fact is that we have 1.3 million people that died, way above and beyond what was expected. So that puts us about 500, 600,000 deaths that occur within a year, where the most relevant factor that may lead to that was not the state of health, but the fact that COVID came in. But why COVID created such a catastrophic situation in Mexico, where maybe the number of deaths is not 270,000, it's probably more than the order of 600,000, which will put us in one of the worst possible countries in the world. Now, why is it that happened? So I'm going to tell you, because I think that immediately tells us what we need to do in Mexico to address health inequality and how we can improve the healthcare of people, which then is going to bring me back to the fundamental new vision at Tecnológico de Monterrey. So there are two simple answers to that. One is the state of health of the country. So yes, we know that mortality associated with COVID has to do with age, and that is a true factor all over the world. But Mexico is not an old country. Mexico is a relatively young country. So we would see perhaps some protection to that. But Mexico is number 4th in diabetes in the world, and it's number 1 in obesity in childhood. And if you look at obesity, depending on where you look, we may not be number 4, we may be number 1 in the world. So the fundamental problem of poor metabolic health with obesity and diabetes is perhaps the catalyst to the increased risk of mortality that we see. So COVID really taught us that Mexico has poor health. Number 2, that the healthcare system is inadequate to respond to the complexity of a pandemic like this. We don't have enough beds. We didn't have enough people trained. We probably don't have enough capacity to support everything. But again, the common denominator that has been perhaps one of the most important problems in COVID, leading to an excess mortality, I'm going to say, yes, is the fact that our healthcare system needs more infrastructure and financial resources. But the fact is that the Mexican people have poor health. And I will say to you, it's not because we don't have money, it's not because we don't have access, it's because of poor choices, poor nutrition, and poor habits. And that is the common risk factor, which of course is totally preventable. And it's preventable if we understand the causes, if we understand what is that we need to do to address it. And I'm gonna say to you that nutrition and habits can solve the major causes of mortality across the world, but perhaps would be for Mexico the answer to decrease COVID mortality and improve into the causes of death of Mexico as a country. And nutrition and habits are preventable problems, are not conditions that are addressed when somebody's in the hospital dying of congestive heart failure or with a stroke or undergoing bypass surgery or coming with diabetic coma. Yes, we solved the problem, and it's partly what I addressed at the beginning of my conversation, that we need to move from a system that is addressing just health as a repair shop, as a condition that needs continuous treatment. And in trying to figure out what is it that Tecnológico de Monterrey wants to do in Mexico, we sort of came up with these ideas. Healthcare today in Mexico, and perhaps is the major philosophy of care across the world, is that care is intermittent. We go and look for care when we need it. We don't go to the hospitals to try to feel better. We need that to be a continuum of care. So today, we looked at healthcare as an intermittent solution to a problem. We need to be in a continuum of care. Care is reactive. It's reactive when you have a problem, you go and fix it. You know, you have a flat tire, you go and fix it. You know, many of us are not checking our tires all the time. We need to be proactive. We need to try to maintain it. We need to move from an individual solution to look for collective solution. Even communicable diseases, even obesity, we think of it as a contagious condition. It's been documented multiple times that obesity is more prevalent when the community where you live is more obese. So we need to transform that to understand that as an individual problem to a collective solution. And we need to be thinking of healthcare not as an unconscious condition, but a conscious decision. You know, this conscious movement has transformed businesses, has transformed more education. We need to have a conscious healthcare approach so that we can transform healthcare. And with those ideas at Monterrey Tech, and I tell you that we in a very conscious effort, we said we not only want to be that repair shop, we don't want to be just the fire station. We need to be an academic healthcare center that transform care, that yes, we provide the possible repair shop, but we need to go one step further. And we have coined these three letters in Spanish that I translated, and Sylvia very nicely put it at the beginning of this seminar as prevention, well-being, and longevity. In Spanish, BPL stands for Bienestar, Prevención, and Longevidad. But we need to transform that in the three major pillars for what we and all of you want to do. We want to transform that in the practice. Each one of us has to be a symbol of those ideas of wellness, prevention, and longevity. We need to transform the educational programs of the students, and we are doing such, but we're going to continue to do it. Tecnológico de Monterrey in Mexico has looked at medical education, not only for physicians, but really to improve the education of the healthcare atmosphere, to try to understand better solutions in a multidisciplinary approach. And I think very importantly, we want to extend this concept of wellness, prevention, and longevity into research that provide better solutions in a multidisciplinary approach. And we believe that is really important. And I'm going to take the last few minutes of my conversation to discuss with you a project that I think is transformational because it's going to provide fundamental biological basis to address wellness, to address prevention, and to have better solutions for longevity. And in this whole idea of transforming healthcare, we said, what is it that we can do that can provide the fundamental basis to answer questions at a different level? So we said, we want to create a project that will function across many disciplines, that will function across Mexico. Then we can provide the seed for investigators from all over the world to link with Monterrey Tech and to link with Mexico to find better solutions, and better solutions that will address these fundamental problems of habits, of nutrition and metabolic health, which I think are essential to fight disease and the major causes of mortality. And we're creating this project that we call Origin. And as you see there, Origin is wellness from the essence. And what is Origin? So let me take a moment to share with you what I think is going to be a critically transformational project for Monterrey Tech, but I believe also for Mexico. So Origin is going to create a community. And this community of individuals will provide in an open platform genomic and epidemiological data of 100,000 Mexicans, that through research, innovation, and training and entrepreneurship, we will promote the development of health so that we can contribute to flourishing of society, which are the fundamental pillars of our vision of Monterrey Tech. So think of it as a group of people that will become volunteers, that will work with the researchers of Monterrey Tech for these individuals to provide in a continuum during time information about their health condition, epidemiological bioinformatic data, but genomic data. We're going to do full genome sequencing for MUST and full genomic sequencing for a very large number of the population. We'll provide in this open platform a repository of information for Mexicans to answer questions, for research at Monterrey Tech, for researchers of Mexico, and it will open it to investigators of the world to try to answer questions that will address the fundamental problems that will lead to better health through prevention and longevity. So let me summarize and share with you that at Monterrey Tech, we're committed to be an example for Mexico and hopefully to the world, where wellness, prevention, and longevity become the fundamental pillars for our new vision, and that we will need to use those to provide better care to patients, to transform the educational programs, and they will provide with Origin a very important pillar for research that will become, in my opinion, one of the most important enterprises that we would undertake in research at Monterrey Tech for the next few years. And if we're successful here, I think that we will be able to address not only questions that will provide better care for Mexicans, but I think opportunities for Latin America and the rest of the world to share information so that investigators can address questions at levels that we didn't have the opportunity before. Thank you for your attention, Sylvia, and I will stop sharing my screen to continue the conversation.
Thank you, Dr. Torre, for your presentation. Very important topics today. And I am glad of being here on the second day in order to continue with this core meeting one. My name is Silvia Olivares. I'm the Academic Dean of Tecnológico Monterrey School of Medicine and Health Sciences. And I want to introduce our guest panelist, Dr. Patrick Fell. He is currently Head of Medical Informatics at UCD and Senior Lecturer, now Associate Professor in Anatomy, with a special interest in clinical neuroanatomy. Following internship in the Mater Hospital Internship Program, he completed a Bachelor in Sciences in Anatomy and Physical Anthropology. Professor Fell has extensive experience in international medical education. Patrick, Dr. Fell, if you can say hello, I encourage everyone to put the speaker view in order to see whoever you are hearing.
Sylvia, thank you very much, and it's a great pleasure and a great honor to be invited to this program today, and a very most interesting presentation from Dr. Torres, and I look forward to the rest of the session. Thank you.
Thank you. I also want to introduce Jorge Brown. He's geriatrician from the Universidad Católica de Chile with studies in public health, master at the London School of Hygiene and Tropical Medicine, and epidemiology, master at Cambridge University. His main interests are focused on designing and coordinating integrated health services for the elderly and comprehensive management of older people with cancer. Welcome, Dr. Brown, and I want to encourage everyone to send your questions by the Zoom chat. And of course, at the end, we are going to have more time for questions and answers. Dr. Brown, if you can say hello so everyone can see you.
Thank you, Silva, for your presentation, and thank you for the invitation. I'm very glad to be here, and I'm very anxious to see the rest of the day. So thank you for the invitation again.
Thank you. So we having some questions. We as a School of Medicine understand that the importance of this prevention and longevity. But of course, the programs used to be or are like more traditional in some disciplines more than others. And of course, I want to ask you some recommendations. And of course, if you can tell us a little bit about what are the most relevant changes that we as health schools should address to promote prevention, well-being, and longevity. I will to ask first, and I'm going to go in order, Dr. Feld, then Dr. Brown, and then Dr. Torre.
Great, Sylvia, thank you very much. Just refresh me the exact question you just asked again. Just
what are the most relevant changes that health schools should address to promote prevention, well-being, and longevity?
Yeah, I think in line with what Dr. Torre said, it's very interesting. I thought his slide on as is and to be summed up exactly where medicine has to go, not just in Latin America, not just in Mexico, but throughout the world. Because I think if there's one thing that COVID has taught us is that it's one world. There's no regionality anymore in terms of this. In terms of medicine, there are no regions. We're one world. We're all traveling all over the place, and whatever happens in one place is going to happen everywhere. Dr. Torre summed it up very well, and he talked about going from intermittent to continued medicine, from reactionary to proactive, from individual to collective, and from unconscious to conscious. And I think what he's saying could be summed up as a move back to public health medicine, a huge move. Public health medicine has been lost in recent years with the huge advances in technology, in medication, and so on. I think the lessons learned from public health education going back 150 years ago were really lost, and they were brought back in the last year and a half. I mean, I think we all remember at the very start of the COVID emergency where, you know, the general teaching from all our health services, from the WHO included, and I'm not a critic of the WHO by any stretch of the imagination. I think they've done a great job, but everybody said, wash your hands, and everybody said there was no need for masks at the start. And I think we all made that mistake. We told our patients that, our health services told our populations that, the WHO told us that, my own fellow countryman Mike Ryan of the WHO told everybody, no need to wear masks, just wash your hands. And really, if you went back, public health medicine would have told us that 100, 150 years ago. And I think Dr. Torre has really brought us back to that. It's all about public health medicine. Public health medicine has to come to the forefront in medical curriculums now. Well-being has to come to the forefront. And I think all of us as medical educators will say that our curriculums hold almost no well-being teaching. I hold a fellowship in sports and exercise medicine. I practice sports medicine. I've been involved with our National Football Association for many years as a volunteer medical officer. And yet in our university curriculum, there is absolutely no sports or exercise medicine at all. There is really no apart from what the cardiologists teach and so on. But that all has to change. And it has to, as Dr. Torre says, or implied, it's got to come to the forefront. And that's my thinking on it. Thank you.
Thank you. Dr. Brown?
Sorry, I was muted. Thank you for the question. I can't agree more with Dr. Fell about the need to highlight the importance of public health education. I would say that what we are seeing now during this pandemic is something that we have seen previously in our history. But also I wanted to add that the idea of a simple disease and a simple treatment the ideas of a simple problem does not exist anymore. I would say that COVID has also taught us that problems are really complex, and probably the solutions that we need to come up with are also complex. And in this complexity, we have factors that are health factors, but also economic factors, social factors that we need also to address. And probably as health educators, we also have focused on mostly on these health solutions, independent health solutions, but also with COVID, we have been faced that social issues, for example, are extremely important, and we cannot believe in an effective solution and a sustainable solution if we don't also focus in those issues as well. So that is COVID, for example. As a simple public health measure in COVID, it has been vaccination, but the uptake of vaccination has been a really important issue in every country. So that uptake and trust in vaccination is not only a health issue, it's about how people see health, how people see the confidence on country system, in governments, in state public measures. So that trust, that confidence is something that it has to be, we have to build up in time, and we have to build up focusing in issues that are not only health. So completely agree more with Dr. Fell, but also wanted to add it about the complexity of these issues that we have been facing with, and probably we will face again in the future. So
what I understand is this is a systemic topic. It's not only about addressing it for the students in medicine, but also for all the healthcare professionals. But here we have a question, Dr. Torre, that it's the scope is bigger than the one that I asked at the beginning. Is Lisetta Hernandez asked if you consider important to incorporate these topics from basic education. So it's further than that. What do you think?
So as I was listening to Dr. Fell and Jorge Brown, you know, I reflected on why I became a cardiologist. And if you allow me, I'll give you an opportunity to discuss that, because I think I'm going to link this to the importance of leadership and figures that become your leaders that you aspire to. Kids in the UK want to be like Cristiano Ronaldo, right? In Argentina and Mexico, like Messi. So we have great leaders. So this is, look at what happened to me. I finished med school at Monterrey Tech, and I went to do a PhD in immunology at the University of Chicago. And I was at all by immunology. And at that time, there was no immunotherapy, there was no immune checkpoint inhibitors. But immunology was a very important field that I looked at as a great potential for health. And I was training with a group of people that were doing genetic assessment and bone marrow transplantation. So I said, I want to be a doctor that takes care of cancer and transplants. So I went to Houston, to Texas, because I was going to go to MD Anderson. There was a great place to for oncology and bone marrow transplant. But see what happened. I ended up at a hospital, where I worked in for so many years, at Houston Methodist Hospital, where a very famous cardiac surgeon worked, Dr. Michael DeBakey. And DeBakey was, in Texas, a figure that was bigger than life. You know, everybody knew him. He was on the papers, on Time Magazine. He would walk with 10 people following him in the hospitals. You know, he would walk in the elevator. People would leave the elevator. Kings, royal people would come. So I was a young kid. I wanted to be like DeBakey, right? So that's what you have in your mind. And eventually, I changed my goal to become a bone marrow transplant doctor to become a cardiologist. I changed my view because of the great environment, the collectiveness of around me that I've admired these people made me change the way I wanted to be trained. So why is that important? Well, I have to tell you that we need more leaders that are these great public officers, great people that looked at prevention, that will evangelize others in that field. I have to tell you that following COVID in Mexico, we see every day people in the world and in Mexico that become our leaders. In America, people love Dr. Fauci. Fauci has been a figure that's transformed the way we looked at public officials in the healthcare atmosphere. Doctors that are infectious diseases are the stars today. Nobody knew infectious disease doctors, but these infectious disease doctors now are providing us with the tools to save others, right? They always did, but we never really looked at them as figures that we adore, that we looked at our idols, our heroes. So COVID not only has addressed the fundamental deficits that we have in healthcare, poor health of the people, poor infrastructure in Mexico, but it also has helped us to see people that we didn't see before that have become our heroes. And some individuals have raised to those statues in all over the world. So maybe every country has a Fauci, but the point that I'm trying to make, we want to change education. Yes, we will do it by changing the curriculum. Yes, you can do it through exposure, and we should do that. But we also need to do it by creating individuals that take an important role in society, that become leaders, so that our young students want to be like them. And that is going to take time. But that needs to happen, because if not, we are not going to really create a movement that changes. I think it's really important to do that. Now, many across the world are doing that today, right? There are people today in Mexico that are leaders that we want to be like. There are others in the world. So I would just add to this conversation that forming leaders that really evangelize the rest in these topics of wellness, prevention, and public health is going to be fundamentally important. And this time in history provides us with a unique opportunity. We don't want that opportunity to happen again, but we need to take advantage of that today.
Thank you. So we need leaders. That's really important. And I heard that this healthy living, it's about habits. It's about also, I understand that you said also in this panel that it's a social issue. So what about our own students? How, as universities, can educate them to eventually become, to eventually become role models for their patients and role models, and also the faculty? how can we address the faculty in order also for them to have these healthy habits and this leadership and all the things that you already said? Dr. Brown, Dr. Fel.
They say that you're on mute is the single most common expression of the past year and a half. Thank you very much. I think, as I said already, I think well-being has got to become part of the medical curriculum. And it is not, we teach disease, we don't teach wellness. And I've been a medical educator for 35 years. And I think it's to my personal shame, and it's really only come to me now that I've been teaching diseases and not well-being and the public health. Okay, they've been doing a little bit of it, cardiology, a little bit of it, Dr. Torre, without a doubt. But really, in the end of it all, what we teach students is disease. And there's very little emphasis on well-being. And I think we've really got to turn things around. Well-being has got to become a very important part of what we do as medical schools, both at undergraduate and postgraduate level. It's got to become a much, much more important part of what we do.
Dr. Brown?
Well, also, it's interesting to see what happened with the pressure of students and the staff during the pandemic. That we are talking now about well-being, but well-being has been an issue for the health team during this year. So, I would say that also for teach about well-being, also we have to take care of our students and our staff also, and to do, in order to do that is extremely important to understand that our educational community is part of the community also that we are living in, and the same community that is facing the same problems as the rest of the society and is struggling with problems that are occurring in the same society. So I would say that also to teach about well-being and to teach about being role models for the patient also is extremely important to teach them to take care about themselves and have and to redirect the efforts as educators to not only teach diseases, as Dr. Fell said, but also to teach about the problems and the issues that every student and every professor in the educational community is facing. So that is extremely important, I would say.
Thank you. We have a comment here from Gillian Webb. She says, I agree, we have to teach health needs to be interprofessional. And I want to ask you, what are the barriers in order to this transition from diseases to well-being and health? Dr. Torre?
Well, I mean, I think that everything is linked and together, really. Our healthcare system, the compensation and the services that we are that we provide are all in disease management. So the hospitals, the clinics are all addressing disease management. The compensation is clearly related to disease management, not to improving the health of people. Now, there are efforts, there are countries that are trying to change. And I am not saying, I mean, we're not the only ones that are addressing it. It's just that to change the whole healthcare system, to change the compensation, it requires a transformative approach. And I think it's not that one versus the other. It's that, yes, we need to have the best repair shop. We need to have the best fire station to solve the problem. Yes, we need the doctor that can remove a tumor from the posterior fossa of the brain in the best possible way. And we need to provide the best pancreatic transplant for somebody with diabetes. But we also need to make sure that people understand that eating carbohydrates all day long is probably not the best thing for your health, and that you need to move around. And how do you balance that is it's an issue, because we have had an unbalanced training, unbalanced leadership. you know, kids in med school go around and they want to be like the doctor that comes out of the operating room with blood all over and tells the family that I saved your husband, I saved your wife. That feeling is powerful. It is an important feeling. I understand it. You want to be like that. But we also need to, and maybe gray hair is the only, maybe you need gray hair to understand it, because I have to tell you that, and maybe I didn't mention that when I went to my story, 25 years of my life, my job was to lead the heart transplant program at the Houston Methodist Hospital. So yes, I help people, right? When you do a heart transplant, you say one person that's gonna die, you give them a transplant, and people come back to life. It's like a plant that's dying, you water it, and it blossoms again. But the fact of the matter is that people, when we transplanted them, you see what happened? They went back to the same bad habits. They continue to be overweight, they remain diabetic, they continue to smoke, which were the factors that led them to need the transplant, despite the fact that we do everything, because it's part of their behavior that is difficult to change. So I honestly, I got tired of doing that. I got tired. And now the students come to me in clinic and all they see me is to teach them about better nutrition, to walk better. I try to avoid giving them medicines because doctors also have become pill providers. So you have a little hypertension, you bombard them with medicine. A little sugar problem, you give them 2, 3 diabetic medicines. And they say they don't sleep, a sleeping pill. And well, they fought with the wife, an antidepressant pill. So, and because they get a little older, they eat late and they go to the bathroom at night 3 times. So you give them medicine for the prostate. So the guy comes into the clinic and leaves with 7 pills, when perhaps everything that he needed is to tell them to lose 20 pounds, to walk and eat before 7 o'clock, not to get intoxicated with massive doses of carbohydrates, and then he'll be fine. But we do that every day in the offices. So we need to change that approach to an approach, but it takes time. So I have the luxury of, I can talk for people in the clinic, I can talk for half an hour. Sometimes I don't do it as well, but I can do that instead of just prescribing pills. And that is a fundamental different approach, right? We are trained to write prescriptions with pills. We're trained to provide doctors or patients with surgery. And it's a little exciting, I have to tell you. And it takes time to understand that we are not really curing the problem, that we need to go to the root cause. And the root cause, I show you the 10 most important causes of that globally. And they start in your mouth and in your habits. So we have better nutrition and better habits, avoid smoking, walking a little bit, and eat better. You probably attack 7 out of those 10 in a very fundamental way. But that requires, yes, training, yes, teaching, but we need examples of leaders. And that's really what I was trying to address. Why do kids in Mexico want to be soccer players? Because they want to be like Messi. They want this lifestyle. They want the glory. They want the applause. I understand that it's all important. But today, who's the most popular doctor in America? Is Dr. Fauci. He's infectious disease doctor. It's not, there are no more coolies and the bakies. They disappear. So I think we need to take an opportunity like that. Yes, transform the curriculum. I think it's really important. But if we don't have leaders that people can aspire to, if we don't teach with example, the simple lecture is not going to do the job. That's my honest opinion. So this has to be a movement. And let me use this as an example, because for those of you that are not Monterrey Tech, we created a new campaign to provide this concept across Mexico. And we said, we want to change, we want to create a wave of health, una ola de salud. We talk about this wave as a continuous movement to make a conscious movement of health. And I think that's what we really need to do. We need students, but we need to have the instructors, the teachers, to be an example of this movement. Not only praise in the great surgery, but we need to try to address the fundamental issues. And we need to have these leaders to be the evangelists of this movement. If not, I think that teaching it alone is going to take a very long time to be transformative, and perhaps it's not going to do it.
Thank you. We here have another question from Lisette Hernandez. How to convince governments to invest in wellness in the face of other needs? Dr. Fel.
Okay, great. How to convince governments? I think that's very interesting. Just listening to Dr. Torre, I was just thinking about probably one of the areas where this has happened. There are a few areas where wellness has been brought in medicine. And one area, as Dr. Torre will know, is in cardiac rehab, and where insurance companies in our countries and public health systems are funding gym programs for angioplasty, I should say, and post interventions, post valve repair, and so on. And these have been very successful. And they are the other thing we didn't talk about yet was research. And I think the benefits of post cardiac rehab are proven. They are absolutely proven. And the research that's been done is very good, very strong. And I think along with bringing in well-being into our programs, I think we've got to start research and really widespread research on well-being, solid scientific research, which I don't think has really been done outside of a few areas. And I noticed that a couple of European countries have brought in exercise programs for long COVID patients as well, funded exercise programs in gyms and so on for long COVID. And I think that sort of thing has to happen. It's got to get government funding and insurance funding, depending on the payment system and the funding systems in particular countries. And that will only happen when there's solid research to back it, which is a little bit difficult because which comes first? How do you get the research done if there's no funding there to do the actual practice? But I think a concentration on getting research funding in, and I think there probably is an appetite for that at the moment, because the results from COVID right throughout the world, as Dr. Torre said, the patients who were unhealthy, unfit, the mortality from COVID was so much higher. And that's going to be the same. And I think we're likely to have rolling pandemics for quite some years ahead. And I think governments have got to take cognizance of the fact that to bring mortality rates down, we've got to bring fitness and health levels up. And the governments are going to have to fund those.
Thank you. Dr. Brown, what about your perspective in your country?
Absolutely. I also agree with Dr. Fell in this point. Research isn't a huge issue. I mean, having the capacity, the resources, the human resources also to provide good research in specific topics regarding to well-being is a necessary step to convince governments. But also, I would say there is an extremely important issue in how we share the results that we have. We usually have this very academic way in sharing results in academic papers. That is, and we teach those techniques to our students. But also, there is an impact that comes also more directly to politicians, is how we engage with the information that we have, those people that are decision makers. I mean, and this is something that I would say that we don't put much effort in how to engage other groups of people with our results. And probably that's one of our greatest goals for the next few years. Specifically, we here with COVID, mental health, which obviously has an impact in well-being, was a huge issue. And a group of researchers from these different universities made up not only a solid research about what was happening in Chile regarding to mental health, but also they build up
a narrative about this, and they engage directly to politicians, and they not only state the problem, but also they provided some really effective and direct solutions also for the problem. So I would say that was one example in which the problem was stated easily for others outside the scientific community to understand, and they also provide the solutions. And that with that, all public health measures for mental health were implemented in Chile during this pandemic. So I would say that's one of our greatest goals for the next few years. Focusing on.
Thank you, Dr. Brown. Dr. Torre, what about your perspective from the Mexican government? How are they willing to invest in wellness?
I think for Mexico it's a little more complicated. I think the first question is that they need to increase the funding for healthcare in general. You know, I think if you look at OECD countries, Mexico's investment ranks very, very low. It's probably no more than a couple of % of the gross domestic product or the GDP. So the first question is to address that. And I've been very public in this issue. And so let me address Mexico, and then we'll take that other comment. I think that I would attack the problem in Mexico first, just to increasing the level of funding, because what's happened historically is the political movements in Mexico are only concerned about safety, security, narco trafficking, and then perhaps corruption. So the political platforms in Mexico do not talk about healthcare. All they do is they talk about kidnapping, narco trafficking, corruption. And those are very important problems. I'm not denying those. But those are suffocating the public in Mexico in a way that does not permit the political parties to talk about healthcare. So COVID has now helped us to have that discussion. And I think that the opportunity that we have today, and it's been highlighted the past year and a half, is the fact that it opened up healthcare to the eyes of the world and to the eyes of the Mexican politicians. And they see that the infrastructure needs to change, that there is really a need to train more people and have well-trained individuals, because we will not have enough to provide attention to the patients. So I think that I say the first one is to highlight the problems, and COVID has already done that for us. Then we need to provide the opportunity for them to recognize that the infrastructure needs attention, that human resources need more formation. And then thirdly, I say, well, once we have that, I think, where do you allocate the pools of money and resources? Yes, of course, but people understand that. I think that we've had very important leadership through the world. Julio Franco was a transformative figure in public health in Mexico, as you know, has been very outspoken of the need to change the healthcare system to provide universal healthcare in a way that's appropriate, recognizing the limitations, and provide a calendar of things. And along with those, there were some issues of prevention. So I think the government in Mexico needs to have healthcare in a platform to discuss with the public. We need to inject more money, and it has to come from political pressure so that the changes in budget can occur. And then thirdly, once you have that, you need a political public health leader that understands. And we've had a few that are very, I think that are intelligent, that are smart, that have attempted to transform. And I think that we can contribute to that by forming within our schools individuals that have this vision, public health vision and prevention as part of their nature. But I think Mexico in that regard has a unique problem, because healthcare has not been in the focus of the political parties. Perhaps 70 years ago, when the Seguro Social was formed, was a major contribution to healthcare in Mexico, right? So if you work in Mexico in the formal, for everyone that's not Mexican here, if you work in Mexico in a formal job, you have healthcare. And the system over 70 years has not evolved at the pace of the needs, but at least people have a way to get access. It has a lot of deficits, and I can complain for hours, but at least that exists. But we have another country that doesn't have health insurance, and I think that's an issue. And so I think that that we have to recognize that healthcare is a fundamental right that we have not paid enough attention, and that we need to invest more. That's how I would address it, Sylvia. I think we need to go first there before even addressing those other issues, which are important. But today, I think we live in a country that's, I used this word before, asphyxiated, right? We don't have enough breathing room. We need more tools, we need more money, and we need to address it, understanding the problems.
Thank you. We have a couple of comments here in the chat, one from Julian Webb. There have been quite a lot of papers coming out of physiotherapy regarding long COVID rehab. So I understand it's something the same that you've been saying, that about the COVID has put another focus on these healthcare issues. And there's a comment from Luisa Remedios. Dr. Manuel Perez Jimenez presented on the issue of inequity in the vaccine distribution at the meeting yesterday. Should U21 Health Science Group be mobilizing our students and staff to lobby governments to put funds into ensuring vaccines are shared across the world? The globe, this will an heroic effort. I don't know if one of you would like to put a comment around this. Yeah, Dr. Fer.
Yeah, I'm also Associate Dean of Medicine in UCD. So, yeah, I mean, I would not agree with us acting as promoters of lobby groups. It's not our business. I mean, I absolutely agree, Louisa, with the idea of, you know, that everybody should, and as private individuals and so on. But as a medical school, I would not propose that certainly for our medical school, I would not propose that we would in any way politicize our student body. It's not our business. I have to be honest with you. I think we would teach them that it's very important and so on, and that we absolutely agree that we should have equality of vaccinations, which is utterly unfair and inequitable the way vaccines have been distributed. My country, we have twice too many vaccinations. We do a lot of work with one of our colleagues in Uganda, and there's almost no vaccination in their clinic there, and we're awash with vaccines in Ireland, as most Western countries are, which is utterly inequitable, and I utterly disagree with it. But at the same time, while I will say that to my students, I would not request or promote anything that would politicize them.
Well, we have a lot of challenges, a lot of opportunities, of course, and some work for the future. So right now, I would like to, I don't know if Ricardo could help us to put breakout rooms in order to discuss, like for 15 minutes, some of the topics that we just addressed here during the panel, in order to be closer to our participants. And there will be one breakout room for each of the panelists, one for Dr. Fell, one for Dr. Brown, and one for Dr. Torre. Ricardo, could you help us to do that?
Certainly, Silvia.
And can I check, are we coming back together then at the end?
Yeah, we are coming back together, and we are going to have a little summary of the discussion from each group. And we are closing this core meeting at the end of that.
So each group should appoint somebody as a rapporteur to keep notes.
Yeah, okay. Some question was, how could U21 Health Sciences Group could facilitate networks and strategies for this future? I'm going to put the question in the chat.
Oh yeah, great.
Just give me one moment to create the breakout rooms.
Well, in the meantime, I would like to invite everyone to the activities that we have. We have both activities from the disciplinary groups. We have activities cultural from the Mexican tradition and culture. So we want to share a little bit of our country with you, with the activities we have prepared during the day. And of course, we are having one of those each day. And tomorrow we will continue also with the core meetings and the meetings from the disciplinary groups. And we are also having also culture activities. We want to make networks. I also want to invite you, everyone, to navigate through the landing page and also to the page with the general program. And you may find also important research contributions from the doctoral forum, which are already in the poster presentations there. Then you can make some messages and remarks about each of the contributions of our students. And today was a great day about that. And today also we are having the Teaching Excellence Award. And I want to, for everyone join us to have a little bit of our nominees and awards, and some of their contributions that will be, of course, real important for all of us. Ricardo, you have any? Okay.
We are ready, Silvia.
Great.
Well, I'm pretty sure you were all talking and we stopped you from doing that.
Yeah,
It's
that's okay.
in this format. Sorry about that. We have only 5 minutes to close this session. I want to thank you, all the panelists, and of course, our plenary speaker for being here with us today. I learned from the session today that we need leaders, that we need movements to change habits, to change minds, and of course, to engage everyone, including the students, faculty, governments, and everyone, and, to understand the importance of talking about prevention and well-being. I don't know if someone of each group would like to share what they talked about in the rooms. Any final comment? Dr. Fell from the room.
Okay, well, Angela's was our rapporteur, and Angela's, are you there?
Yes, I'm right here.
Thank you.
Yeah, you want to put Angela's up because she's much more eloquent than me.
Actually, the discussion that we had in our group, it was very on the lines that you say. Gillian Webb and Dr. Faz were talking about that is not an issue that could be addressed just by the School of Medicine, but for all, as you just mentioned, it involves everyone in the community. And some good could come out of it if we rethink and bet on prevention rather than in treating the illnesses. And there is a need of shift on the focus. Of course, changing behavior is not an easy task, and it will be really hard to do, but it's something that we need to start moving towards.
Thank you, Angeles. I don't know if someone from the room of Dr. Brown would like to share something. Dr. Jorge Brown?
Yeah, sorry. We were talking about how to gain trust in the system. We pointed out issues about information transparency and how the physical and geographical situation of each countries would impact the trust in the health sector as a whole. So it was a short but interesting discussion.
Yeah, I know. Thank you, Dr. Brown. Dr. Torre.
No, I think you should make the comment, but I mean, I would just summarize it that we all agree that prevention and a public policy at the different level in the countries is important to have through transformation. But we, from a university perspective, have to get more involved and more actively change the curriculum and provide example through leadership to our students and other fellow colleagues, so that we can not only teach this movement of prevention, but also live it, so that really our education becomes much more effective. I would probably close my comments with that commitment to not only teach, but live that as an example to others, the attitude of prevention and looking at health as a continuum, as a conscious continuum of care, as opposed to just looking at repair what's defective.
Thank you very much. Good summary. We are closing the session 1, and we would like to invite you to stay here in order to connect with us for the plenary, The Reality of the Pandemic and Health Professions Educations. Are we living an alternate reality? And of course, the panel, The Alternate Reality of Health Professions Educators. We are going to continue soon, so do not disconnect, and we are going back in a few minutes. Thank you very much.